I'm an adult gerontology nurse practitioner student, and today we are going to be performing head, eyes, ears, nose, throat, and respiratory, as well as cardiovascular assessment. This shouldn't take over 20 minutes. Is that okay?
Yeah.
All right, and just for your information, we are recording this physical assessment. Do I have your consent?
Yes.
Excellent. All right, I'm going to ask by asking you a couple of questions. Can you tell me your first and last name?
GK Salvakumar.
When is your birthday?
January 1st, 1990.
What year are we in?
2025.
And where are you right now?
Home.
Excellent. So now my general assessment is you are alert and oriented. Your mood appears to be cooperative and pleasant. You appear to be in no distress. Your skin tone is even all throughout, and you appear to be well nourished. So that's awesome. All right, I'm just gonna take a look at your face real quick, and I see that your face is symmetrical. I don't see any drooping. Your head size seems to be appropriate to the size of your body, so that's great. Now I'm just looking at your head. I don't palpate any lesions. I don't palpate any masses. I don't see any lesions. There's no depression on your skull. I'm also inspecting for any infestations. I don't see any head lice. There's no balding spots or alopecia. Your hair seems to be evenly distributed all throughout, so that's awesome. All right, now we're just gonna assess your cranial nerve 7, which is your facial nerve. I'm gonna touch you over here and let me know if you feel that.
Yeah.
Are the sensations the same on both sides, or one is more than the other?
The same.
Excellent. Now raise your eyebrows for me, smile for me, frown, and puff out your cheeks. Excellent, and you did all of that with ease, so that means that your cranial nerve 7 is intact, so that's great. All right, now we're gonna assess your cranial nerve 5, which is your trigeminal nerve. I need you to bite down on your cheeks or clench down. All right, and now I'm palpating your masseter and your temporalis. Great, and I feel strong muscles there, so that means that your cranial nerve 5 is also intact. Now I'm gonna assess your TMJ, or your temporomandibular joint. So I'm gonna have you close and open your mouth while I palpate your mandibular. Excellent. And I don't hear any clicking sounds or grating sounds, which is great, because if I did, that could indicate a dislocation. All right, so that's awesome. All right, so now I'm looking at your eyes, and I'm just inspecting your eyes right now, and your sclera is white, your conjunctiva is pink and moist. I don't see any drainage coming out from your lacrimal apparatus. Your eyelids are not swollen. Your eyelashes are all equally distributed, so that's great. Now we're gonna assess your pupils. I'm gonna shine a light on your left eye. Good, and same thing with your right eye. Excellent. All right, so your pupils are both brisk and reactive to light. They're about size 3 millimeters, which is normal. And I saw your right eye constrict when I shone a light on your left eye, and same thing happened when I shone a light on your right eye. I saw your left eye constrict, and that means they're both consensual to a light, so that's awesome. Now we're gonna assess your cardinal fields, which include your cranial nerve 3, your oculomotor, your cranial nerve 4, which is your trochlear nerve, and your cranial nerve 6, which is your abducens. Excuse me. All right, so I'm gonna need you to take a look at this, DK, and I need you to stay still and only follow me. I'll follow the pen light with your eyes. Excellent. I did not see any nystagmus or abnormal movements in your eyes, which means that all your cranial nerves 3, 4, and 6 are all intact. So that's awesome. All right. So I did your eyes. Now we are going to check your accommodation. Follow this pen light only with your eyes. Great. I also did not see any abnormal movement, so that means you're accommodating. Your eyes are accommodating. So that's great. All right, so now we are gonna do the cover test. I'm gonna cover your right eye a couple of times. Same thing here. All right, so I did not see any movement on your uncovered eye while I was covering the other eye, which means that both of your eyes are aligned and there are no misalignments, so no abnormalities there. So that's great. All right, now we are gonna assess your distance vision using Snellen chart. So I will need you to read this last line for me. Cover your right eye and read this last line.
LTFPH.
Excellent. Now cover your left eye and read this last line for me.
LTFPH.
Excellent. So your vision is actually 20/20, so that's great. Your visual acuity is normal, and it basically means that you can see at 20 feet what a normal person would see at the same distance or at 20 feet. All right, so now we are gonna do we're gonna test your red reflex using my ophthalmoscope. All right, good. So your red reflexes are both present in both eyes. Your retinal backgrounds are normal, and your optic discs are sharp. So that's great for both eyes. All right, now we are gonna move on to your ears. So I'm looking at your left ear right now, and it looks intact, no drainage, no swelling, no lesions. Does it hurt when I touch you here?
No.
I'm also gonna touch your tragus. Do you feel this? Is there any pain?
No pain.
Excellent. I'm gonna do the same thing with your right ear. All right, no drainage, no lesions, skin is intact. I'm gonna palpate you here. Do you have any pain?
No.
I'm also gonna palpate your tragus. Do you have any pain here?
No.
Excellent. All right. So now we're gonna take a look at your inner canal using my otoscope. All right. So your left ear has pearly gray tympanic membrane. Your ear canal is pink, and your cone of light is 7 with left ear. And now we're gonna assess your right ear. All right, so your ear canal is also pink on the right eye, on the right ear. Your tympanic membrane is shiny and pearly gray on right ear, and the cone of light is at 5 o'clock. So that's awesome. That's normal. That's expected. All right, so now we're gonna assess your cranial nerve 8 or your vestibulotracheal nerve. And we're gonna do that by doing whisper test. So I'm gonna cover this ear. I'm gonna go here. And you verbalize what I whisper, okay?
50. 20.
Excellent. Now I'm going to do this.
50. 23.
Great. So it's both equal. So that means that your cranial nerve 8 is intact. So that's also awesome. All right. Now we're going to move over to our Ryan test. So I have a tuning fork here. I'm going to hit this with my knee. You're going to feel a buzzing sound. I'm going to move it closer to your ear. And you're going to let me know what's louder, point A or point B, okay? Point A, point B.
A.
Point A, point B.
A.
Excellent. And do the same thing with your right ear. Point A, point B. Point A, point B.
A.
Excellent, good. So that means your ears are both equal and symmetrical. Now I'm gonna do the Weber test, and I'm gonna do the same thing. You're gonna let me know if left is louder than the right, or they're both equal.
Equal.
Same. All right, good. So they're both symmetrical. That's a good sign. So that's awesome. All right. So we're done with the ears. Now we're gonna move to your nose. Right now I'm looking at your nose, and your nose seems symmetrical. I don't see any septal deviation there. I don't see any excessive drainage or any lesions. Now I'm just gonna palpate your bridge and your soft tissue, as well as your cartilage. All right, now let me know if you feel any pain while I palpate your your soft tissues, cartilage, and bridge. Any pain?
No.
Good. Now I'm gonna palpate your maxillary sinuses. Any pain?
No.
Good. And now I'm gonna palpate your frontal sinuses. Any pain?
No.
Excellent. So no pain in your sinuses, no tenderness noted. So that's great. Now I'm just gonna take a look at your nose with my pen light. All right. I don't see any polyps. There's no excessive drainage, and there is no nasal septum deviation there. So that's also great. Now I'm gonna have you cover your one nostril or one nair, and take a breath. Okay. Do the same thing with your left nostril. Cover your left nostril. Take a breath. Okay, so I heard good airflow there. That means both of your nostrils are patent, and that's nice. So we like that. All right, so now we are gonna assess your cranial nerve 1. That's your olfactory nerve. So I'm gonna have you cover your eyes or close your eyes, and I'm gonna put something in front of your nose, and you're gonna let me know what it is that I have here.
Alcohol swab.
Excellent. So it's an alcohol pad. That means your cranial nerve 1 is intact. So that is great. All right, now we're gonna move over to your mouth. I'm looking at your mouth, and it's symmetrical. Your lips are pink and moist, so that's great. I don't see any lesions or any abnormalities in your mouth. All right, now I'm just gonna take a look at your buccal mucosa. If you could just open your eyes for me. Sorry, open your mouth for me. Okay. Good. I'm also looking at your gingiva. Okay, your hard palate, soft palate, and your tonsils. So your buccal mucosa are both pink and smooth in appearance. Your gingiva are both pink and they look firm. Just gonna perform high hand hygiene while I'm talking to you. Your hard palate and soft palate appear to be smooth as well. No lesions noted there. Your tonsils are both symmetrical. They're not swollen, so that's a good sign. And your gingiva are also like they firmly grasp and they have like a tight seal around your teeth, which is great. Your teeth are also intact. I don't see any missing teeth, so that's also a good sign. All right. So now I'm just gonna assess your cranial nerve 9, which is your glossopharyngeal, and your cranial nerve 10, which is your vagus nerve. So I'm apologizing in advance. It might feel a little uncomfortable. I'm gonna put a tongue depressor in your mouth, and it's gonna activate or it's gonna trigger your gag reflex. Okay. Okay, good. So your gag reflex is intact. That means that your cranial nerves 9 and 10 are also intact. So that's great. You all right?
Yeah.
All right. So now we are going to assess your cranial nerve 12, which is your hypoglossal nerve. So I will have I need you to stick your tongue out against the side of your right cheek while I pressed against it. Okay. Same thing with your left cheek. Excellent. Tongue muscles are strong, which indicate that your cranial nerve 12 is also intact. So that's awesome. All right. So now we are going to assess your sense of taste, and that's your cranial nerves 7 and your cranial nerve 7 and cranial nerve 9. All right. So I'm going to have you close your eyes, and you're going to let me know whether this is sweet or it's sour. Okay. And before we do this, do you have any food allergies?
No.
Any nut allergy?
No.
Okay. Here you go. Okay. How's that taste?
Sweet.
Excellent. All right, so that's chocolate, so it will be sweet. That means your cranial nerves 9 and cranial nerve 7 are both intact. Awesome. All right, now I'm going to take a look at your neck real quick and your trachea. Your trachea seems to be midline. Can you swallow for me a couple times? Excellent. All right. All right. I feel the swallowing upwards, which means that the trachea is midline. Now I'm going to assess your lymph nodes, starting from your chin to your mandibular, to your tonsillar, to your pre-auricle, to post-auricle, to your occiput, and your supraclavicular. So that's your auricular, rather. All right, so I'm going to need you to move your arms out a little bit. I'm going to palpate your axillary lymph nodes. Good. And your epitrochlear. Same thing here. All right, so I didn't feel any lymph nodes, which is a good sign. I didn't feel any enlargement of your lymph nodes or any swelling. If I did feel that, it can indicate an infection, could be cancer, could be an autoimmune disease or injury. So good, I did not feel any of that, so that's awesome. All right, so now we are gonna move over to your anterior chest. I'm looking at your chest right now, and your chest expansion looks symmetrical. Your thoracic configuration is also symmetrical. I see that your breathing is unlabored, and it's pretty consistent. It's pretty regular and normal, so that's great. All right, now I'm just gonna listen to your lung sounds. Take a deep breath while I listen to your lung sounds. Okay, good. So your lung sounds are present on all fields. I did not hear any adventitious sounds. Your lungs are clear, so that's great. So now I'm also going to measure your trachea, make sure that it's midline. Swallow again for me a couple of times. Excellent. And I'm looking at it, and I don't see any like deformities or any asymmetry on your neck and your trachea. It looks midline to me, so that's great. So now we're going to do what's called tactile fremitus. So what I'm going to do is I'm going to put my hands on your chest, on your anterior chest, and I'm gonna need you to say 99 as I move along. On your chest, okay?
99. 99. 99. 99.
Okay, good. So I felt like vibrations all throughout your your lung field, so that's a good sign. Now we're going to start percussing to measure your diaphragmatic excursion. So I'm just going to directly percuss your cartilage. So not cartilage, your clavicle. Right, so I did not feel any dullness. I did not, I only heard resonance, and that's a good thing. That's a good sign. Now we're going to go to your posterior chest. I'm looking at your posterior, and it looks symmetrical. Your thoracic configuration also looks symmetrical. I don't see any deformities or anything like that. Now I'm just going to listen to your lung sounds, okay? Take a deep breath for me. You can move forward a little bit. All right, so your lung sounds are clear and equal in all fields. I did not hear any adventitious sounds, so that's also good. And we're gonna do the same thing we did earlier. We're gonna do the tactile fremitus, okay? So I'm gonna move along on your posterior back, and I need you to say 99 as I go.
99, 99, 99, 99, 99.
Good, so I heard vibrations on all lung fields, so that's a good sign as well. And now we're gonna percuss to measure your diaphragmatic excursion as well. Move forward a little bit. All right, great. So I also felt resonance on all fields. I did not feel any I did not hear any dullness, so that's also great. All right. All right, so we had to pause the video to do our cardiac assessment because we had to go to this location. Now I'm just looking at you, and your skin looks even all throughout. Your skin looks appropriate for your ethnicity. I don't see any pallor. You don't look pale. Your lips look pink and moist. Your skin is warm and dry. Your skin turgor is fast, which is great. Now I'm just gonna do a quick assessment on your jugular vein. I'm gonna need you sitting up a little bit to 45 degrees. Oh, that's perfect. All right, so I need you to look towards that side. I'm gonna take a look at your jugular vein. I don't palpate it, it's not visible. And same thing with your left jugular. I don't palpate it, it's not visible. And that's a good sign. We don't wanna see a distended jugular vein. All right, you can lay back now. So that's great. Now I'm just gonna listen to your heart sounds, okay? We're gonna start from your apical valve to your pulmonic, to Erb's point, to tricuspid valve, and to your mitral valve. All right, great. I only heard S1 and S2, which are normal heart sounds, so that's awesome. Now I'm going to listen to your PMI, or your point maximal impulse, and that's going to be on your fifth intercostal space, mid-clavicular, so right about here. And I'm just going to turn my bell to listen for any extra heart sounds. All right, I didn't hear any gallops or murmur or any heart sounds. I'm also going to take a look at your pericardium while I'm here, about the same location. All right, I don't see or feel any thrill or heave. Okay. I don't see any dislocation in that area, so that is also awesome. All right, now I'm just going to check your cap refill real quick. All right, so your cap refill on all of your upper extremities are less than 2 seconds, which is what's normal, so that is great. I'm also gonna assess your cap refills on your toes. All right, and they're all less than 2 seconds, so that's also awesome. And while I'm on your legs, I'm also gonna assess for edema. I don't see any edema or discoloration, so that's fantastic. All right, good. All right, so now we are gonna assess your 6 major arterial vessels, starting from your brachial artery to your radial artery, ulnar artery, dorsalis pedis, posterior tibial, and your popliteal artery. All right, great. So they're all palpable, about +2. No thrill felt there, so that's awesome. Now I'm just gonna listen to your arteries, okay? I'm also gonna use the bell of my stethoscope to listen for your abdominal aorta. I'm also gonna listen to your renal aortas, your iliac aorta, and your femoral aorta. All right, so I did not hear any bruit or any abnormal vibrations there, so that is great. So that concludes our physical assessment. Do you have any questions for me before we end?
No.
All right, thank you for your time.